An unprecedented and unpredicted rise in demand for autism assessments and ADHD treatments has left the NHS struggling to cope. That's the warning from the health think tank, the Nuffield Trust. It says patients are being prevented from accessing vital care. Our science correspondent Thomas Moore has this report.
As Kevin's finding out, it's not easy these days to get a diagnosis of ADHD on the NHS.
It's important to mention that a reassessment may result in a diagnosis of ADHD not being made.
Frustrated by delays, he went private to see a world-renowned psychiatrist for a rigorous 20-hour assessment. But now he's been told to get NHS treatment to keep him calm and focused. He still needs to join a 12-month waiting list to confirm what he already knows.
When I've spoken to the managers of the ADHD clinic in Staffordshire, they said that it's not our fault, it's the commissioners, it's national policy, it's Whitehall who are responsible for this, and we have to follow this process. That's not good for a person who has got the condition and wants to get on with life and, have medication.
Rising awareness of neurodiversity is driving up demand for a diagnosis. Latest figures show more than 170,000 people in England were on the waiting list for an autism assessment in December, the highest ever reported. Official guidance says people should be assessed within 3 months, but 79% of people had been waiting longer. ADHD waiting lists are also thought to have grown. A survey by a parliamentary committee last year found 24% waited between 1 and 2 years for an appointment and 10% between 2 and 3 years. It matters.
So for a child, for example, having the diagnosis may mean that the school understand that you can't cope as well with a very noisy classroom, that you're going to learn in a particular way, that you need time out, that you need support in the way in which you are going to interact with your peers. And therefore, they can wrap that support around you and give you the experience so you can thrive.
Kevin's life is in limbo while he waits for treatment. An NHS spokesperson said a task force had been launched with the government to provide a joined-up approach to care. But for Kevin, it's all far too slow. Thomas Moore, Sky News.